Okay, guys, let's begin. So I believe all of them have joined. Okay, so what we are going to do today is we are going to discuss all the 4 modules. So this will be beneficial for the people who are writing exams tomorrow. So we will be discussing on writing, reading, speaking, and at the end, we'll be speaking about listening. What all things you need to avoid in listening, what kind of technique you should use when you're doing your listening task. This is something which is necessary for everyone to follow, and we'll be focusing on that today. Okay, now I want each one of you to please mute your audios. I'm just saying it once again. The reason is do not unmute until and unless you have a question to ask, so that those who are trying to learn will not have any disturbance. Thank you so much for that. Now let's begin with this. Okay, somebody has joined now, I guess. Just give me a minute. Perfect. Okay, so let's begin. So I believe now there is no one will join. Okay, now we'll start with writing. So I will be describing each and everything, whatever you've learned till now. So if you have any doubt at the end, you can definitely ask, or in between, if you want me to explain something again, I will definitely go through that. Okay, so first of all, I'll be going through each and every structure what we have learned till now, that is for discharge, referral, and transfer, so that when you write your exams tomorrow, if there is a question on referral letter, you don't have any confusion. So we'll be discussing each and everything, whatever is present in writing, reading, listening, and speaking. So let's begin with discharge letter. Now, I don't want any confusion in the structure when you write. I want you to formulate the structure in the 14 equal points. So your writing structure should have 14 equal points. So the first thing, I don't want any confusion in this. If they have mentioned your hospital where you're working, this will be the first thing that you will be writing. No change in this. Name of the hospital where you're working. There is a reason for mentioning your hospital name in the letter. Now, there are certain people who try to use it at the end, that is in the closing. That is also fine, no problem or no error in that. But what I suggest is on the top, write name of the hospital where you are working. That is more important. Okay, but if in every letter it is not possible, that they will be giving you this. But if there is any letter or the case note where your hospital name is given, you need to write that. After this, leave one line. Second thing would be name of the person to whom you're writing. That is whoever you are intending to write, that person's name. Third thing, designation of that person. Now, there are certain times they'll not give you the name of the person to whom you're writing, they'll only give you the designation. So your second point will be designation of that person to whomever you're writing. Fourth thing would be your address, what you're willing to write. And in address, there is one thing should be very common, should be followed, that is no punctuations. No punctuations over here, which means at the end, you will put only a full stop. No commas after street name, no commas after apartment name, or no comma after any pin code or a short code, anything what is given. No commas at all. Only at the end, you will put a punctuations. After that, you leave one line. Your fifth thing would be your reference. Sorry, this will be your date. So the fifth thing what you write is always the present day. Now I know most of you will have a confusion, the letters which you're solving nowadays, that which means the practice material what you have, you will see the data as admission date 2010 and the discharge date 2010, and the year is given as 2011, 2012, whatever the year is given. So how will you write the present day? This is what the confusions most of the candidates do have. So please understand the letters which is given to you as a practice materials, those are just a previous year's question papers. So whenever you get a question paper in your examinations, you will get recent date of 2018. So until and unless in your question paper, it is written that today's date is some other day, it is always going to be the present day when you're writing your exam. So 11th August, 2018, until and unless it is written in your question paper that today's day is some other day. This is something which you need to be careful about. After this, you leave one line. So the lines which I'm leaving, the gap which I'm leaving, you also need to maintain this for the better presentation. Okay, now you will see second, third, and fourth. I'm not leaving any line, not required. After fourth, I'm leaving one line, and then I'm writing the fifth point. Then again, I'm leaving one line. I'm writing the sixth point. The sixth point is always going to be the reference, which is going to be patient's name and age. See, there are n numbers of approach which you will find over the internet. Okay, there may be n numbers of trainers who gives different approaches. What I would suggest is, see, I have seen good results out of this, so I believe if you follow this, you're going to get your scores easily, no doubt in that. Because at present we have 80% OET results which we have achieved. So we feel even you guys can easily achieve with the same structure, with the same things what I've taught. We have achieved 80% result of OET. So I'm very sure this technique and this structure is totally accepted. So if you have learned something from other things, or you've learned something from the internet, that is one of the approach. So even this is an approach which is approved and by which we have seen the results. Okay. Now, seventh one, after that you leave your one line and you try to write your salutation. That always starts with dear. Now, the second point, which is name of the person to whom you're writing. If you know the name of the person, then you will write it over here. There are certain letters where they don't mention any name of the person. They will only mention the designation and to whom and the hospital where you're writing. And that point of time, when you're not aware about the person's name and gender, you will always write dear sir or madam. If you're writing it to a neurologist, or if you're writing it to a nurse, it's not necessary every time a nurse is going to be a girl or a woman. No, it can be stored as a madam. If the name of the person is not given, it's always going to be dear sir or madam. After that, you put a comma. Then you start with your eighth point. That is your first paragraph. Please understand, this eighth point is always, you can either leave one line and start your first paragraph, or you can just start with the next line. This will be your first paragraph. Now, when tomorrow you write your exams, most of you are giving your exams tomorrow, in first paragraph, I want you to maintain 5 W's. I want to see this in your paper. I can assure if you're able to display 5 W's in your first paragraph, easily you can achieve. Half of your work will be done if you're able to write your introduction paragraph well, which is all about the initial health. A half of your work will be done. So this is something which you need to focus on. So now let's discuss the paragraphs. I'm just erasing this so that I can write more. Eighth point is about first paragraph. Now, this first paragraph is completely based on 5 W's. Now, let's understand what are these 5 W's. The first thing, what you need to write about the patient, about the letter is, okay, one more thing. This paragraph is called as overview of the letter. Overview of the letter. So I want you to write 5 W's in this. First thing is who the patient is. Never start your letter by stating this, the presented patient has come to us with the diagnosis of no. This is always better to write, I am writing this letter, or I am writing this letter, or you can write this letter is in reference to the above mentioned patient. Is in reference to the above mentioned patient. Now, why I'm saying this above mentioned patient, the reason for that is that in this letter, please make sure in the reference part, you're writing the patient's name and age.
Hey, George, can I interrupt you?
Yeah, sure. Go ahead.
Okay, there is someone who's not able to hear properly, if I'm not wrong. Just hold on, okay?
Yeah, please.
Someone on Oppo, there are 2 girls sitting together. They're trying to listen to you, but they're unable to hear.
So they need to activate the voice from the device, because from my side, it's perfect.
But I could just see that that's a little weird though. That's why.
Yeah. Who is it, but actually?
I don't know. Can you unmute them?
I'm not so sure who are they, because I cannot see. There are approximately 27 participants over here, so it will be very difficult for me to track them. Who's that?
Okay. All right. Leave it then. If they're not able to hear, that's the big trouble.
No worries. I'm recording the session. They can definitely watch it later. No problem. Perfect. Thank you.
Sorry to interrupt you.
Yeah, thanks. Okay, so this is the first point which you need to be very clear about, who the patient is. Now, the reason why I'm saying it should be above mentioned patient, the reason is in the reference, you're writing the patient's name and age. So you need to be very sure you don't repeat that information. That's not required, because the person to whom you're writing, he's very clear about whom you're writing the letter and why you're writing the letter. He's very clear with your reference. Okay, patient's name is this, patient's age is this. Do not repeat that in the first line of your letter. Okay. If anyone is trying to speak something, please understand your voice is muted. I'll not be able to hear anything. So if you want to ask something, you'll have to unmute and ask. Okay, so your first point is who the patient is. Second point, what was the diagnosis? So this is something which you write, the patient was presented to us, or he was presented to us with the diagnosis of, or manifested with signs of chest pain, fever, whatever you write. But please make sure if your case note has got a prime diagnosis, which has been said like pneumonia, cholera, or maybe diabetes, hypertension, there is a prime diagnosis you see. You will always mention the prime diagnosis in your first paragraph. Do not focus more on associated symptoms. These are some don'ts which you should not be doing in your exams. That is associated symptoms. See, you have your second paragraph or third paragraph to mention your associated paragraph, your associated symptoms, but not over here. This is something which you need to be really careful. Do not write the associated symptoms in this paragraph. Your first paragraph need not to be more than 6 lines. It should be within 6 lines. So what was the diagnosis is the second point which you would be writing. The third W is when was he presented? If there is an admission date given, when was he presented? He was presented to us 4 days ago. He was presented to us on a particular day, whatever day has been given. You can write your admission date over here. This is your third W. Fourth W is what is the current condition of the patient. You need to write in short what is the condition of the patient right now in this one line. It should not be more than 1 line of the patient. And your one sentence should be minimum 7 to 8 words. Please make note of it. Don't write a sentence of 2 to 3 words. That should not be there. So please make sure what is the current condition of the patient is something which should be written over here. This is required. He's able to walk with the help or with the help of support, or it can be patient is completely stable, unstable, prognosis is poor, whatever you find in the case notes. Your fourth W, your fourth sentence need to be about the current condition of the patient. And the fifth one is what is your purpose, your reason for writing this letter. Clear your purpose over here. What is the purpose of your letter? Why are you writing? Justify the reason. Do you want the further line of treatment? You want the further assessment from the patient, from the doctor, or it can be anything. Whatever your purpose is, or maybe for the further care, further treatment, further support, whatever your purpose of your letter, the reason, exact reason why you're writing your letter need to be over here. And one more thing, guys, when you're writing your paragraphs, do not copy words or sentences from your case notes. Please understand this. Everything, whatever is given to you is in the note form. To an extent, it's okay. 3 or 4 words, it's okay, but not much. Try to paraphrase it in your own words when you're writing a letter. Paraphrasing is something which is really required when you write your letters. So please make sure that you paraphrase the content, whatever you see it in your case notes. Never ever write the same words from the case notes. You should not be doing that, okay? Now, after this, the second paragraph. I'm talking about discharge letter, guys. Please make note. Second paragraph. Now, second paragraph is called as initial health. The name of these paragraphs, whatever the topic that I have given, I have the idea what I've given for the paragraph. This is something which should be there in your mind, because that will help you even if you're not aware what kind of letter you're writing. This will help you to achieve what is required in your letter. Initial health means the initial symptoms, or you can say the previous background, the initial level when the diagnosis which he has now, the symptoms which was evolved in the initial period, you will write about that. This is called as initial health of the patient. Now, in this paragraph, you will be mentioning about medical, social, or personal background, if you find any, or at the time of admission. I'm writing it if you don't find anything medical, social, or personal, or at the time of admission. At the time of admission, what patient, what kind of symptoms? This is what I'm talking about, associated symptoms. What kind of associated symptoms at the time of, or what kind of associated symptoms he was presented with? To understand, this is a paragraph where you will be writing about medical, social, and personal. It does not mean you will be involving all the three data. No, you will try to find which one is the most important data which I should be including into my letter, which is relevant to the current condition. This is something which is necessary when you write your paragraphs. You need to make sure whatever points or whatever point you're going to take that need to be relevant to the current diagnosis. Okay, this is something which is necessary. Perfect.
Excuse me, sir.
Please say.
Can I ask a question here?
Please say.
Okay, in terms of this medical, social, and personal background, is it part of past medical history?
It's about past medical history. It's not about current. This entire paragraph is going to be about the past medical history. Okay.
Past.
This is about history. It's completely about the past. This is either going to be about the initial symptoms, which is again going to be the past when he was admitted to your hospital, or it's going to be about the background of the patient. So it's always going to be the past. Okay. Perfect.
Everything that happened in the past.
No problem. Yes,
right.
that's correct. Okay. Fine. I'm just muting it once again. Now, at the time of admission, whatever kind of associated symptoms patient was presented with, all those informations you will be involving in the second paragraph. Then the third paragraph is all about recent treatment and progress. Please understand this. See, the topic, the idea, or the heading what I've given, that itself says what you're going to write in this paragraph. This is something which need to be very clear in your mind, guys. Now, recent treatment and progress, whatever patient has gone through recently, whatever treatment was given, whatever progress he had, how he responded to the treatment, his response to the treatment, all those informations you will try to include in this. This can be about a recent fall patient had in the hospital. It can be about a recent weight gain. It can be about a recent allergy developed. It can be about a nosocomial infection, whatever has happened recently. So please understand, this paragraph is all about recent events. The latest and the recent events, what you can write over here in your letter, it's all about that. So please understand, whatever patient has gone through when he was admitted in your hospital, in your department, when he was there with you at that point of time, what all kind of progress and treatment was given to him. For example, patient had a hemoglobin drop, then you have transfused 3 pack cells to him, and right now his hemoglobin as well. All those informations you can write in third paragraph. Now, there is also one more approach which people do approach or do actually in their letters. That is, they move this third paragraph to second paragraph, and the social background paragraph, they move it to third. Even that is acceptable. That is not a wrong concept. It's completely fine. You can write in the second paragraph, you can write about the recent treatment and progress. And in the third part, you can write about the social background or the social history. It's completely fine. No problem with the structure. Okay, so please, those who are following that, you can continue to follow it, no problem with it. So the third paragraph is all about recent treatment and progress. So here you will be writing all the symptoms or all the progress what he had when he was recently there with you in your hospital. And your fourth point, I'm just erasing this, your 11th point, which is your fourth paragraph. Now, this fourth paragraph is going to be all about your request and recommendations, what you have for the patient or to the person to whom you're writing, whatever you recommend or whatever you request, whatever you want from that person to do for this patient, or what you want the patient to do in future. So this paragraph is called as future follow-ups. Future follow-up. So whatever you want the patient to do in future, all those things. For example, you're writing it to a neurologist, you want a further line of treatment, or you need the person to, just a minute, yes, you need a person to do an urgent assessment. You want the person to do a future follow-up. You want the person to help the patient to have a future follow-up at the hospital, or send the patient for the suture removal. Send the patient after 10 days. You can say after 10 days for suture removals. It can be anything, whatever you want the person to do in future. All those things you'll mention in this paragraph, wherein you're justifying your purpose. You're saying This is my purpose. This is something which I want the patient to do in future, or this is what I want you to do. I want you to hire a device for this patient, which will be useful. Call a physiotherapist for his movements, for his exercise, whatever you have, the suggestions, recommendations, and requests, you will write in this paragraph. So this paragraph is all about the advices, all about the request, or if you're writing a reference letter, all about the recommendations, what you have for the patients, or perfectly for the person to whom you're writing, that is your target reader, you will mention it over here. This is all about the future things. So please understand, if you just think back and see, your first paragraph is a combination of all the three tenses, past, present, and future. Your second paragraph is all about the past events, that is past tense. Your third paragraph is all about the recent events, so which will have past as well as the present tense. And your fourth is always going to be about the future things. Okay, so do not get confused in these things. It's very simple: overview, past, present, future. These are your 4 paragraphs. So keep this in mind. And then you have the 12th point, that is your closing. Your closing will be not, there are certain changes I've seen in closing people do, which is beautiful, so I've not corrected. The simple closing is, if you need any further clarifications, please do not hesitate to contact me or my department. I've seen other closings as well. It would be grateful, it would be greatly appreciated if you look into this case, and if you need any further, even that is fine. But make sure your letter should not be more than 220 words. It should not be more than that. And at any chance, it should not be less than 180 words. So I will always suggest to keep a target of 190 to 200 words. This is something which is required and you should be doing it. And after this, you leave one line and you write yours, wherein your Y is capital, and there is no apostrophes, no possessions in when you write yours. Then sincerely, your S will be small, no capital letters over here. Even if you put a comma, it's fine. If you don't put, even that is fine. You can leave one line, you can write your designation, nurse, head nurse, whatever is given in your letter. But if there is nothing given, no designation has been mentioned, you simply write it as nurse. Simple, that's all. Now please make sure 190 to 200 words is your target. Nothing less than 200, nothing less than, 180, nothing less than 180. It should not be there. So you should always have a target of 190 to 200, because if you make any spelling mistakes, any errors, those words will be deducted from your word count. They'll not even count that. So please make sure you always keep a safer side of 190 to 200 words. That is something which is required when you're trying to write this. So nothing less than 180 and nothing more than 220. This is the maximum limit. I would suggest be in the limit of 200 words. Don't go above that. Okay, this is something which is required. So in letters, you need to be careful about this. And one more thing, please understand, when I say about the word count, it's only about the body of the letter. Your address, your reference, your salutation is not counted under the word count. Only the body of the letters, that is from the first word of the first paragraph to the last word of the last paragraph. That's all. Okay, so your address, your reference, your name, nothing has been counted in the word count. So you need to be very clear about this. Okay, perfect. Now let's move on to the referral letter. Okay, so now.
Hello, sir, I have a question.
Yeah, please go ahead.
Okay, in referral letters that in discharge, okay, this is discharge letters. Okay, in a letter that has multiple dates.
Sorry, come again.
In any letter that has multiple dates.
I'm going to that. Those are referral letters. I'm going to that. So just hold on. I'm just going to that. Just hold on. Okay.
All right. Thank you.
Thank you. Now we are talking about the referral letters. Now referral letters are for 2 types. Please understand this. The first type, there are 2 types of referral letters. This is something which you need to be very careful. Types of letters in referral. Okay, there are 2 types. One is same like discharge letter. You will find a case note wherein the patient's information is given, wherein you will find the medical background, you will find the recent history, you will find about like patient has been recommended to a different department, maybe to a physiotherapist, wherein he will just go get his physiotherapy done and will come back to your department. So that is same like discharge letter. There is no change in the structure. The structure will remain the same. Overview, background, recent things, what has happened in your department. Fourth is about your future follow-up, and fifth is closing. It's going to be the same. The second type is where you have multiple events, or you call it as multiple dates. Multiple events or multiple dates. This is something which you need to be really be careful about, and you should be very careful in choosing information, because here they are testing your ability, how well you can prioritize information, how well you can summarize what is given to you in front of your eyes, that is in the form of case notes, whatever they have given you, how well you can really summarize these things and put it into your case note. This is something which is required, and this is something which they are going to do it. So let's see, when you have multiple events or days, what you need to do. That is something which I'm going to clear. Now, let me also tell you one more thing about this multiple dates. There are two things which you need to be very careful about. When you see multiple dates, the first thing you need to see, how many dates do you have? If you have less than 5, there are 2 criteria. Second one is more than 5. Okay, keep this in mind. I'll tell you why I'm telling you this. There are 2 criteria in multiple dates: less than 5 dates, more than 5 dates. Okay, now this will be useful in your second paragraph. That is the reason I'm telling you that you should always be able to count how many dates have been given on this letter. Now, your initial structure I'm not writing again, because it's going to be the same: name of the person to whom you're writing, your address, your designation, the person's designation to whom you're writing, the reference, the present day, salutation, everything is going to be the same. Your first paragraph, your first and fourth paragraph is going to be the same for all the letters. Your first paragraph is again going to be about the overview of the paragraph. No change. Overview, that is 5 W's. Please make sure all these 5 W's have been maintained in your first paragraph. Write an impressive introduction paragraph. Because when you write an impressive introduction paragraph, your half of your work is done. Because please understand, this is not a computer screening. English language trainer is sitting on the other end of your in the OET, other end of your side, and that person is assessing your paper. So please understand, when they open up a paper and they see a very good handwriting, very well presented, and your first paragraph is impressive, where you have covered all the 5 W's, you have clearly stated who the patient is, so they understood, okay, fine, you were able to find who the patient was. Second thing you say about the diagnosis and the admission date, they are clear, okay, fine, this candidate also understand what was the prime diagnosis, he was able to pick up the prime diagnosis, he was able to pick up the admission date. Third thing you say, what is the current condition? By which you are telling the examiner, okay, I was also able to, from all this piece of information, I was able to find out what was the current condition, and I know what is my purpose of writing. These 5 things are clear in your first paragraph, half of your work is done. Examiner is very clear with your letter that you have understood what you need to do with this letter, or how you need to write this case. So your first paragraph is really important. So you need to make sure you write your first paragraph clear and crisp enough. Okay, now this is your first paragraph, is going to be about the 5 W's. Your second paragraph, I have told you, it's always going to be about the background. But when you have multiple days, there is a slight change. Whenever they give you multiple events in your referral letter, most of the time they will not give you any history. They may even give you just a line that with this letter, the medical history will be attached. But they will not say anything about the history. They will not give you any history. The reason is your second paragraph need to be involved some other data. Now, the second paragraph, I told you, it's all about the initial health or initial stage of the patient. This is all about that. So when it comes to a referral letter, it's about multiple dates. It's called as initial events. Now, in this, if you find any medical, social, or personal history, if you find, most of the time you will not find, but if you find, whichever you find the most relevant, pick 1 or 2, not more than that. Not more than 2 pieces of information. Pick which is the utmost emergency. If you feel like, okay, this is something more important which I should be informing to the other person, that is to my target reader, pick up that 2 pieces of information, because you'll be adding here, if I've told you over here multiple dates less than 5 and more than 5. If it is less than 5, you will describe the first event or date which is given to you. The first date. the first event. The first event which is given in your letter, you will try to mention that. Now, if your dates are more than 5, then you will describe first 2 events or dates over here. If it is more than 5, first 2 events or first 2 dates. This is something which you would be doing here in your second paragraph. So this involves medical, social, or personal history. If you find any, which will be rare, plus you will be describing the first 2 events if you have more than 5, or only the first event if it is less than 5. This is something which you're going into your second paragraph. Now, your third paragraph, this is what called as recent.
Excuse me, sir.
Yeah, Shania,
Can you give us an example of what you mean when you combine the past medical events?
I will send you a
with the
sample.
first?
Right now, I don't have access to the sample. I'll send you a sample where you will see how the dates have been described. Okay. I'll send you a sample of the referral letter wherein you can see the statement and you can see how well they have combined, because the history, you will not find any kind of history in multiple dates letter. Most of the time you will find events. So you just need to describe that events. Okay. So I'll send you a sample of this. Perfect. Now, your third paragraph is always going to be, I've told you about the recent events. In your referral letter, it's going to be about the recent events, which means you will be describing about the last 2 events. So the most important events to us are the first 2 events and the last 2 events. Okay. Second paragraph, you will describe over the first 2 events if it is more than 5, and the third paragraph, even if it's less than 5, the last 2 events you will mention it over here. Now, if you have like 10-15 dates and you find, okay, fine, apart from this first 2 dates and last 2 dates, I find a piece of information which is important or which may be important for the target reader, you will add an additional paragraph in between second and third. An additional paragraph in between second and third. This will be an additional paragraph. So this is something which you would be doing if you're doing your case notes, your referral notes. Okay, so first paragraph, 5W, second paragraph, initial events, maybe the first event or the first 2 events. And then you will have, just give me a minute. Okay, sorry for that. Okay, so your third paragraph is going to be describing about the last 2 events. So whatever the last 2 events have been given, whatever the progress, which is about the recent activities, you will mention it over here. Nothing more than that. Okay, then your fourth paragraph is going to be the same. That is about your request and recommendations, what you have for the patient. Whatever request you have it for the doctor, whatever request you have it for the physiotherapist, whatever the target reader should do for the patient, all those informations you will try to involve in the fourth paragraph. And the fifth is going to be closing. That's all. Yes, Eben, you want to ask me something?
Yes. Sir, you told that there should be an additional paragraph between second and third. So that should be for more than 5 events or less than 5 events?
No, it's not. It's even if it's less than 5 or more than 5. If you find anything more important, okay, see, there will be a letter where you will find less than 5 events, because in your OET exams it will always be more than 5. Okay, so if you find anything important apart from the first 2 events and last 2 events, I want you to add an additional paragraph in between this, but not after third paragraph, because you will lose the flow of writing and there will be no coherence in your writing. So that is something which I want you to avoid. So I want you to add in between first, second and third, not after third. Okay.
Thank you.
Yep, perfect. Thank you. Now, after this, I'll go to transfer letter. But before that, I want to state something over here. Please make sure when you read your case notes, they give you the first 5 minutes for reading your case notes. So when they give your case notes, please understand, the first thing you need to understand is who is your target reader. Keep this in your mind very clear. Who is your target reader? The reason is, if you're able to understand the target reader's point of view, it will be easy for you to understand what kind of information should I pick up from the case notes. It will be pretty easy for you. Because if you're writing it to a dermatologist, only the conditions related to the skin is required to be mentioned more often, and it is required to emphasize more on the skin related problems into your case notes. If you're writing it to a social worker, please do not involve anything about the treatment, about anything much about the history, not at all required. You directly need to attempt the points which are given about the patient and your reason for writing those letters. That is something which need to be focused. So the reason for this point for telling this is, please understand the target reader. Who is your target reader? Is he a medical person? Is he a non-medical person? If he's a medical person, do not write anything much about the medical history of the patient. There will be much more information given to you in the case notes, which will be pointing more towards the society. So you can involve those points, but not medical things. The same way, if you're writing it to a family doctor, you can write, see, please understand, family doctor, whenever you write, you can write about the present medical history, you can write whatever had happened in the hospital. That you can write, but the past medical history, do not mention about it, because he's a family doctor. He's aware about the past medical history. But whatever has been happened recently, the present medical history, definitely you need to inform him, because he may not be aware. If, for example, the case, maybe patient was admitted with you for a month, and he's getting discharged, and you're writing it to a family doctor. So what all had happened in this 1 month, he may not be aware. That is a present medical history. But the past medical history, everything he may be aware. So that is something which you should be mentioning. But the past medical history, do not involve it in your letter. So please make sure, first thing when you write your case notes, understand your target reader, very clear and crisp. Understand who is your target reader. If that is clear to you, it will be pretty easy for you to write your letter. You will be able to finish it on time. And I want you to keep a target time of 35 minutes, because 5 minutes, I want you to reread your letter, understand if there is any punctuations error, there is any spelling mistakes, whatever you find, that is something which you need to be more careful. Okay, this is something which I want from you. So please make sure you understand your target reader, and accordingly you write your letter. There is one more thing which I wish to say over here. Now, if you're not able to understand what kind of letter I'm writing, for example, you're not able to understand whether it is a discharge, referral, transfer, whatever it is, there is a general structure, keep in your mind. First paragraph is going to be overview. Your second paragraph is going to be about the initial, that is your past history, initial health. Your third paragraph is always going to be about the recent events. Please understand, recently what all had happened, the recent events is always going to be about that. The fourth is going to be always about the request and recommendations. And your fifth one is going to be always about the closing. No change in this. This is what the general structure is all about. So this is something of flow, which you need to be doing, which you need to keep it in your mind. So you should always be doing this. This should be there in your mind. Okay. This is something which you need to be careful about, and this is something which you should be doing it on a daily basis whenever you're doing a practice, or maybe you're writing your exams tomorrow. Please, if you're not able to understand what kind of letter you're writing, keep this general structure. It's very easy, pretty easy, guys. First paragraph is all about the introduction and overview. Second is going to be about the initial health. Third, recently what all had happened. And fourth is about the future. So please keep this in mind. Now let's move on to the transfer letter. Transfer letter. Please understand. Again, our initial structure remains the same. First paragraph and fourth paragraph remains the same. First is going to be about the overview, but in overview, the 5 W's will have a small change. I'll just mention this over here, 5 W's. Now, here you will write, first one, who the patient is, same. Above mentioned patient, above caption patient. Second, what is his diagnosis? What is his diagnosis? Third thing, when was he presented? Fourth, when is he getting transferred? Maybe tomorrow, day after tomorrow, maybe today. Fourth, why is he getting transferred? That is your purpose. Again, the same. Why is he getting transferred? These are the 5 W's which you need to be mentioning in your transfer letter. Okay. Second thing, your second paragraph. Here, this is called as, see, normally we call it as initial health. This is called as describing the prime diagnosis. Prime diagnosis and its associated symptoms. So in this paragraph, you will mention at the time of admission. See, normally transfer letter has been written from a primary hospital to a tertiary hospital, or maybe you're writing a letter from one hospital to another hospital. Most of the time, this is the scenario which I've seen in transfer letters. Your second paragraph will describe all kind of associated symptoms, what patient had initially, maybe fever, nausea, uh, vomiting, rashes, whatever you find. You will describe more about the prime diagnosis, what he had when he was admitted to you, and the associated symptoms which he had at the time of admission. So at the time of admission, whatever patient has gone through, whatever you have done for the patient, you will write it over here. Then when you move on to the third paragraph, this third paragraph will be like, third paragraph is always called as a recent events. So this third paragraph is going to be about the developed recently developed associated symptoms. Recently developed associated symptoms. Recently developed associated symptoms. This is something which you need to be careful about. Okay, so this is something which you need to be careful. You need to make sure your third paragraph involves all the recent symptoms, all the recent things which had occurred and due to which you're transferring the patient. So these are those symptoms and those complications. These are called as recent complications as well. These are those complications for which you're transferring the patient to other department, or transferring the patient to another hospital, or maybe to a tertiary center, whatever the recent complications or the recent trouble or the recent reason for which you are shifting the patient. This is something which need to be mentioned in your third paragraph. Your fourth is going to be the same, request and recommendations. Fifth is going to be the closing. And then your, whatever your closing is, yours sincerely, whatever your designation is, that's all to be written. There should not be any confusions. Do not jumble your informations. Do not try to complex it. Now, I'll also tell certain learners, I'll advise one. Please guys, please mute your audios. Anyone has any doubt, you can definitely ask one by one.
Yes.
7 seconds.
Hello. Yeah. So the letter for the transfer of a patient to a community health center, that also comes in a transfer letter only, no?
See, I'll tell you one thing. If your question, the question what is given to you in the case notes, ask you to write a transfer letter, then it's a transfer letter. Otherwise, keep it in mind the same letter, the same general structure in your mind. You cannot gaze up whether the given letter is a transfer, referral, or discharge. Do not confuse yourself in this. Do not confuse yourself. See, whatever I'm saying, the reason for the transfer or your purpose of your letter, both are same. So if it is not clearly saying whether it is a transfer, discharge, or referral, keep a normal discharge letter structure, the general structure in your mind, and write your letter. Do not complicate yourself in between the discharge, referral, and your transfer. This I have told you just to have a clear understanding of your information which need to be informed. Otherwise, keep it a simple general structure in your letter. So this is a point which I want to even keep it up over here. There are certain learners, I know you are behind learning vocabularies of writing. See, that happens with IELTS exam. The vocabularies and all those things really help. But in this exam also, it doesn't help much. The reason is, please understand, the person who's sitting on the other side is a non-medical person. He's just a EFL or TESOL certified English trainer who's sitting on the other side correcting your papers. So please understand, they want to read a simple language where you're able to communicate, where you're able to write whatever is required in the case notes. You're able to communicate with the other person and you're able to decipher all the informations what is given to you in the case notes. This is something which is required. I want a simple language in your case notes. We don't need complex language. We do not even need complex sentences. All those jargons we don't need. We only need a simple language where you're able to communicate. The other person is able to understand what kind of request or recommendations you're putting up, what you're saying about the patient. Everything has to be in a simple language. You know, certain times we really amazed by looking at a person who have cleared an OET or IELTS exam that how did you make it? Because your language is not so good. You didn't understand that his language was very simple. And that is something which the examiners are looking at and they clear the exams. The reason is he wrote everything very simple. His writing task, he wrote it very simple and he was able to communicate what exactly was intended to communicate. So that is something which is required in your letters as well. write it as simple as possible. Do not write it as you're writing a case notes or a plan, what do you say, a care plan, which you write in your nursing profession. It's not a medical letter. This is not a medical exam. This is just a benefit which you're getting, an additional benefit, that everything is related to your profession, regular profession, but this does not include anything which is related to medicine. So please understand, write it as simple as possible and write it in a simple language. Keep it simple. Okay, this is something which I want to guide in your letters. Now, yes, you carry on. Shania, you want to say something?
Yes, I want to,
Okay.
I want to say something, sir.
Yes, yes.
Please, I want to add something. It's confusing, but you might be surprised about it anyway. In some of the letters, discharge letters, they said write like in a discharge letter, they require a nurse to go to the patient's home to render personal care or to
Correct.
care for the patient.
Correct.
What group of letter do we put it? Because sometimes
Correct. See, sometimes when you get such letters, you will not get a letter wherein you are going to the patient's home. That will only come in the speaking notes. Okay, you are going to the patient's home. That will always come in speaking. But in writing, you will be writing to a physiotherapist on behalf of the patient. You're writing to physiotherapist.
Yes.
You want that person to go to the patient's house.
Yes.
Right? Then it's going to be the same discharge letter format. No change in that.
Okay, discharge letter format.
See, I told you, referral letters has got two types. That also comes under referral letter, but of that same kind of referral letter, wherein you will follow the normal structure of overview, the past medical history, the present recent events, and the future recommendations what you have for the physiotherapist. You want the person to help him to teach how to walk with a walking stick. It can be about a leg exercise. It can be about a passive exercise. Whatever suggestions you have or whatever recommendations you have for the physiotherapist, you will try to write it in your fourth paragraph. It's going to be a simple letter, simple discharge letter format. Okay, keep that in mind.
Okay, I have not finished with that part because in that letter, do we require to give the home care nurse the past medical history of the patient?
Yeah, the person.
Do we require to go in details?
You need to go in details. You need to go in details if you're writing it to a medical person. Okay, if you're writing it to a medical person, you definitely need to go in detail because that patient is new to that person. Okay, then definitely it's okay. But if you're writing a social worker to go to a person's home and visit him and help him with getting the pensions and all, obviously medical history and everything in detail is not required. Okay, so you need to understand who is your target reader, who is going to read and who is going to help. That is something which is required.
Okay.
Done?
That's what I want to find out. Thank you, sir.
So much. Okay. Now let's move on to the other things. I'll move on to reading quickly. Reading does not have much. It's all about your skills because there is nothing that you can learn in the last moment. Reading, OET. I'll just give you some suggestions which will help you in your exams, especially with part A. Please make sure as you get your paper, first identify the main topic. Identify the main topic. What is it about? What is the prime disease condition on which the complete entire 4 text is going to be. First, identify the topic. Second thing, identify the 4 perspectives. That is a 4 text. It can be, you need to understand what is it about. Is it about treatment? Is it about causes? Is it about research? This is something which you need to identify quick. Is it about statistics? Once you identify this, then go to the questions. The reason is you hardly have 50 seconds in your hand. So you need to be really quick in finding answers. You should be really quick in finding the exact location where your answer would be. So the reason for that, if you understand my first text is about causes, second is about introduction, then if you're reading a question and you feel, okay, this question is about causes, then I don't need to scan any other paragraph. I'll directly go to the causes paragraph. So you will not waste your time. So this is something which you need to be very clear. Please don't sit and read and try to understand each and every word. Here, what they're checking more is your skimming and scanning skills. So skimming is nothing but where you're trying to read fast and try to find the information, and scanning is something where you try to locate certain words. Like for example, the question is about in which year a particular thing was invented. So you're trying to find years in your complete paragraph. So that is something called as scanning. You're trying to find one particular number or one particular word So you're scanning, the way you move your eyeballs and try to identify the words and the sentences, that skill is called as scanning. So that is something which comes with constant reading. When you have an ability to read, that time it really helps you with. You need to have a minimum capacity of 200 words per minute. When you have the speed, it's easy for you. Part A. So read your questions carefully, and whatever answers you find for the part A, it need to be grammatically correct. It should fit. It should align with the entire sentence, grammatically correct. It need to be grammatically perfect sentence or the perfect word, whichever you're choosing. It should fit in with that sentence. The entire question should sound grammatically correct, whatever words you choose. And also it should not be more than 3 words. It should not be more than 3 words. Your answers should not be more than 3 words. It should be within this limit. Also, there are certain times when you see that a particular word is not fitting into that particular sentence, you can think of a synonym which will fit there. That is something which is required. You should be able to think of some synonyms and you should be able to put it there. But whatever word you're choosing, synonym is completely fine. It's not required the same word has to be there. No, you can put a synonym, it's completely fine, but make sure that synonym fits in there. This is something which you should be doing in part A. You need to be quick with it. And the formulation of part A is something which you really need to understand very clear. Formulation of part A. And now, please understand question number 1 to question number 11. Mostly, in most of the papers, this has intermediate difficulty. Intermediate means medium, not hard, not easy. Intermediate difficulty. Question 12, this is just my analysis. This is not from OET. I'm giving you my analysis, which I've seen in questions. Question 1, question 12 to question 19, I have seen most of the questions are complex. They take time to solve. And I've always seen question number 21 or question number 20 to 27 are always the easiest one. They don't keep the complex one at the end because they want the candidates to get good score. So what you can do is, if you're solving your test and you're finished 11th minute and you feel there are only 4 minutes left and you're at the question number 15 or 16, leave it, go to 21 to 27. Take a shot for 21 to 27. I can assure you, you will get all the 6 answers correct. The reason is that will be the most easiest one. That is a formulation of tests. I have analyzed approximate 40 tests, 40 mock tests I've analyzed, and I've seen question 1 to 11 is always an intermediate difficulty, but in between questions are the more complex ones, and the last 6 to 7 is the most easiest ones. Okay. Also, please understand, if you are doing this method, make sure you do it in the last 3 or 4 minutes. Do not risk it in the beginning. Don't try to be over smart and do till 11 and directly jump to 21 to 26 and try to use it. No, this will not work. In the last 2 to 3 minutes, this will definitely work for you. Okay. Please make sure, please be very alert. Do not look what other person is doing, what your neighbor is doing, or what question he has got the same question paper or not. Don't try to do this. You will lose your time. After 15 minutes, they will not even give you an additional 30 seconds. No, they will collect your paper as soon as possible and they'll give you part B. So this is something which you need to, this will be useful for you. Part A. Okay. Someone has unmuted. Anyone want to ask me something?
Yes, can I add something?
Yeah, Cristiano, tell me.
Yeah, in the test day, because I don't remember now, they're going to tell us the last 5 minutes.
No, the timer is going to be displayed in front of you. There will be a huge screen on which the timer will be displayed and you can see your time. Okay, and they would also be announcing the last 5 minutes, the last 3 minutes, last 1 minute. Do not listen to that and get panicked, because most of the candidates, when they listen to that alertness, what they're giving, last 5 minutes, last 2 minutes, they get panicked. The candidates start getting panicked, like what should I do? Only 2 minutes are left. Relax. 50 seconds or 40 seconds is more than enough for a question. You need to relax and do not play with your mind. Do not get nervous. That's all to be done. Okay, Cristiano?
And how many gaps we have to figure correct in the part A?
For B, how many answers?
How many answers?
That depends on your
Yes,
number of questions. That depends on your number of questions. We need 33%, for example. If you have 29 questions, you need 12 answers to be correct. Okay. Now, if you have, say, about 21 questions, you need approximate 9 answers to be correct. So it depends how many questions you have. So it's 33%, it need to be correct in part A. So you have a relaxation in part A.
Okay.
So please do not worry much, do not panic much. The requirement is not too high, it's less. But when you go to part B, the requirement is different. That's the reason they have given 45 minutes for part B. Okay?
Yes, thank you.
Okay, thank you. So I'll move on to part B. So please understand this part B is the most important one. This you need to be very careful. Part B, please understand the way the examination is formulated is different. Part B, they have given you 45 minutes. There is a reason for this. Because when you do your practice test, you may realize I'm doing it within 20 minutes, 25 minutes, I'm able to complete all the 20 questions. But when I check my answers, I land up with 12, 13, or 14 score. The reason is you did not pay attention to the time. You need to make sure that you spend at least 2 to 3 minutes on one question. There is a reason, because all the options, because every questions, whatever you read, has got 4 options, right? And all these 4 options, whenever you read any questions, all the questions will have 2 possible answers. So there will always be a close connection between 2 options, and you may feel whether my A option would be right or my C options would be right. I'm not able to judge which one is the closest match. And they want to see how well you can read, comprehend, and understand the closest match. And what hinders in between identifying the closest match is something called as qualifying verbs. Now, qualifying verbs, I've been telling all of my lecturers, please understand, whenever in your sentence, whichever sentence you feel this is my answer, you read that sentence once again, which you feel matching my questions, read the sentence once again and make sure it does not have words such as since, always, maybe, although, because, or you can say mainly, majorly. These kind of words can change the meaning of the entire sentence. There can be one word which changes the entire meaning of the sentence. This is something which you need to be really careful about. You need to make sure there are no such words in between and it does not change any meaning. Then you should be go ahead and matching your option. You should be stating or marking your options. Also, please understand, whatever options you choose, whichever options you choose, I'll just write it in a note form. Whatever options you choose, you need to make sure the entire information, word by word, I am emphasizing on this, entire information, word by word, should match with your paragraph. So there is a reason for this. See, understand, there are qualifying words which would change the meaning, which can change the extent of the degree of the sentence, which can change the extent of the meaning. It can be anything. But until and unless your entire information, word by word, I'm emphasizing on this, word by word should not match, until and unless it doesn't match with your sentences, that is not your right option. Please understand, in this part B, we are not matching words, we are matching the meaning of the sentence. So this need to be stuck into your mind. Word by word is my option, matching with the sentence in the paragraph, and that is your right option. Also, there is also one more thing which really works, which we use in psychology. We have seen your instinct. There are certain times when you are not able to identify what is the correct answer. You're frustrated, you're completely exhausted, you're not so sure which one should I choose. Choose your instinct, the first option which comes to your mind, choose that and go ahead. If you're not able to find it, if you're finding it too difficult, too complex, what should I decide? Follow your instinct. 99% instincts are always correct. So this should only be done when you don't have any option, when you're not at all able to understand. For example, questions on statistics. You're not at all able to understand what should I choose. Choose what comes to your mind first. The first decision, what comes to your mind, choose that. 90% of the time, the answers will be correct. Okay, this is one of the method which you can use, but don't rely on this. Don't rely on this, otherwise it will be your game. Actually, your game which you won't even realize what the results would be. So don't rely on this, but this is one of the method which you can use when you're not so sure what need to be done. Okay, that is about reading. So please make sure in your part B, read carefully. First, read question, register that in your mind. I'm emphasizing on this, register the question in your mind. You should be able to remember what you read, what was the exact meaning, what they were asking for. Then read options. Each options, whatever you read, each and every options, whatever you read, it should be registered into your mind clearly. You should understand the meaning of the option, what is given to you. If that is clear, it will be pretty easy for you to understand what the question and what you need to do about the paragraph. This will be easy for you. That is all about reading. Reading,
Sir,
yes, tell me.
can we write anything in the question paper of reading?
Yeah, that's fine. If you're, even if you're underlining, you're trying to write the options next to the paragraph, it's completely fine. No problem. Okay, perfect. Now, let's move on to speaking quickly. Now, speaking, please understand you have got 3 sections, introduction and 2 role plays. Introduction does not come under assessment. Does not come under assessment.
Excuse me, sir.
Yeah, please.
Sorry.
Yeah.
Can I ask something? What about part B? How many questions do we have to have?
20 questions.
Correct.
You will have 20 questions and minimum we need 15 answers right. This is a minimum requirement. For grade B, you need 15 to be correct. Nothing less can be compensated. You cannot compensate with part A. You have to have 15 answers in part B. But if you get less in part A, for example, out of 9, you only got 6. And in part B, you get 17 or 18, it can be compensated. But with part B, you cannot compensate. Okay? I know your question was about to be like, can we compensate if we get good in part A?
Yes.
Not possible at all. Okay? Because most of the candidates do feel like if I get more in part A and if I get less in part B, can we compensate? No, we cannot. We need minimum 66%. This is the requirement, 66% in part B, which is 15 answers. This should be there. No change in this. You cannot compromise on this. So you need to go slow. Okay?
Okay, thank you.
Perfect. I'll move on to part speaking. So speaking, please understand what speaking. This is something which you need to be careful. There'll be 3 parts. Your introduction part does not come under assessment. So they will ask you certain questions, no assessment for this. Certain questions such as, may I know your name? May I know your profession? From how many years you've been working into this profession? Tell me a good experience, bad experience, all those questions related to your profession. You can be very comfortable, no assessment. And the person who's sitting in front of you as a role player does not have any authority to assess you, so you can be relaxed on that. No assessment will be done by the person who is taking your exams. Only your recordings will be assessed and only your recordings will be sent to you. Sent for the assessment, and only that assessments will have marks, but your person who's sitting in front of you will not do any assessments. Then you have role plays. And role plays, you need to make sure when you're starting your role play, you will be given 1 minute to prepare, 1 or 2 minutes to prepare. In this preparation time, if you have any doubts about the question, you can definitely ask. No problem with it. Any pronunciation which you don't understand, you can definitely ask to the role play, but after that, you cannot. And once your 1 minute is done, you will be starting the communication in your role player. Introduction. They will just say, okay, let's begin. So you will start your introduction, and your introduction should have 4 things. Greetings, that is good morning, good evening, whatever it is. Your name, your designation, and your offer to help. This is something which is required in your introduction paragraph or your introduction section of your speaking. Be clear with this. For example, hello, good morning. My name is so-and-so. I'm the head nurse at this department. How may I help you? This is something which should be done in your introduction paragraph. Okay. After this.
Excuse me, do I ask for the person name or?
Yeah, it depends on the situation.
It
depends on the situation. If you're talking to a person who's already in the hospital, you are being assigned nurse, most of the time the name would be given. But if the name is not given, you can definitely ask just to reconfirm, may I know your name? You'll not be bumped on for that. But if the name is given in your question paper, if you're asking for the name, then it will be marked down. So be very careful that there is no name mentioned in your role play card. Then you can definitely ask, no problem with it. In your role,
and if I just call him another name, is it any problem?
No. You cannot call any other name until unless you confirm about it. You cannot. If there is no name given, you'll have to ask for the name. That is something which is required. And always when your introduction, you will have to give your own name. Introduction, your name should be mentioned. Your real name should be mentioned. Okay? Perfect. Now, this is about the introduction. So these are the 4 things. Hello, good morning. My name is Suensu. I'm the head nurse of this department. How may I help you, or how are you doing, or may I know your name? This is what your introduction is going to be. And after this, there is something which is going to be your body. In your body, you'll need to make sure within 5 minutes, 5 minutes is your task time. Within 5 minutes, you move through each and every task. You move through each and every task and finish it within 5 minutes. Do not entertain any irrelevant questions. If there is an irrelevant questions, make sure that you tell them that I'll definitely help you with that information, but after a consultation, and bring back the examiner to the task and finish your task within 5 minutes. And after your task, you feel like, okay, I've spoken for 4 minutes and all my task is finished. If they ask you any questions, you can definitely answer because your task is finished. You don't need to worry about it. And once your task is finished, they'll give you 15 to 20 seconds to summarize. But this does not come under assessment. But if you're able to conclude, if you're able to summarize your task, there may be a chance that you may get a grade A. Wherein you say that, okay, Mr. Smith, for example, I'm taking a pseudo name. Okay, Mr. Smith, I believe that you have understood whatever I've advised you. And I'm pretty sure my suggestions will help you to get an optimal recovery. So this is something I'm trying to summarize what we have spoken, and I'm trying to end the communication. So your role play should have 3 things: introduction, body, and conclusion. This is something which you should be keeping in your mind: introduction, body, conclusion. And you will have 2 role play cards. The first role play, most commonly, it will be a direct role play wherein you're speaking to a patient. A patient will be sitting in front of you and telling you like, I have this problems and all those things. Second will be most likely to be an indirect one, wherein you're speaking to a relative, a friend, or a cousin of a patient who is trying to inquire about the patient on behalf of him and trying to know the condition of the patient on behalf of the patient. So someone on behalf of the patient will come and talk to you. So this is something which you need to be careful about. Okay, these are 2 types of role plays, and you will have 2 role plays in your speaking test. You need to make sure all the 3 parts have been maintained, and you will be speaking only for 10 minutes. Combine both the role plays, and only that 10 minutes will be assessed, and that will go into assessments. Nothing else. This is something which you need to keep in your mind in terms of your speaking. The last part is listening. There's nothing much in listening, guys. Please understand, in part A, this is also your completely skill-based. Reading and listening is completely skill-based. There is nothing to teach much, but there is some tips which we can give. Part A, always write short sentences. Do not write long sentences. And before even you do this, always understand when you're doing a listening test, have an interest to know what the topic is. Have an interest to know what the communication is all about. Whenever you have an interest to know the topic, that definitely help you to understand, and that definitely help you to recollect the information what you heard, which will help you to write your answers appropriately. Do not write long sentences. Write short sentences in part A. And in part A, when you write, they overlook spelling mistakes, grammar. The grammar is overlooked, spelling mistakes are overlooked. Even if you make any blunder, any mistakes in your spellings, it's completely fine in part A. No problem with it. So they're just looking you to write in a simple note form. They don't even want a proper sentence over here. They only require a note form. So if you're able to write it in note form for part A, that's all is enough. Nothing else is required. Write in the note form, write as small, as short as possible. The sentences should not be too long, because the pace you will not be able to catch it. That is something which you should be doing in your listening part. Go slow, understand, and write it in a very short sentences, no long sentences, but your writing speed need to be improved. You need to make sure that you write fast, because audio will not wait for you, and you don't have any option where you can replay your audios. No, there is no other options for that. So you need to be doing it, and you need to be writing very fast. Part B, the pace would be a bit high. The pace of the communication would be a bit high. So make sure your focus should not go here and there. Don't look at anyone. Just be focused from the beginning. Even if they are giving you some instructions about the test, it's okay. Be focused from the beginning. And here, grammar is important. So whatever sentences you write, you need to make sure you write grammatically correct sentence. Grammar is important. Over here also, avoid long sentences. Avoid lengthy sentences. This is something which you would be careful in part B. Avoid lengthy sentences, because you really don't have that much time to write lengthy sentences. go write as short as possible, but grammatically correct sentences is required over here. Okay, this is something is required in part A and B, but always when you start listening is your first test, which you would be doing in your OET exams. So always have a clear focus of what you're going to do. Your focus need to be very clear what you're going to do. Okay, and what you're going to listen. Don't look at the person. Don't look if someone's headset is not working. He gets up and say, my earphone is not working. Can you do something? Don't pay attention to him. They're not going to go replay it. And if your earphones has any problem, you feel like I'm not able to listen to it, allow it. And in the beginning itself, alert that my earphones are not working. Can you change it? Don't wait for it. And if someone has any trouble, you don't look for it. Don't waste your time. Don't lose your focus. This is something which I want from you. That's all. And listening, be focused and try to understand what has been played. That's all is required. Rest is, please understand, be positive about your exams. Do not even say tomorrow morning when you get up for your exams, do not even say, will I be able to do it? Don't doubt your abilities. You have learned many things throughout this training. You're going for your exams. Be sure, be confident enough that you will be able to make it. Because most of your thing comes with your thought process. Please understand, keep your thought process positive and believe you're going to do it. Half of your work is done, because whatever you're learning, whatever you're absorbing goes into your subconscious mind. It has got a hard drive, it has got a database, where if you're very confident, you will be able to grab all the information, whatever you learned, you will never forget anything. Just be positive, keep your thought process positive, and give your exams. I'm sure you will have a good result. Easily you will clear, and this attempt is going to be the best attempt. That's all I need from you. Any questions, anyone? You can definitely ask. That's all for today.
So can we capitalize in reading part A?
No,
the
you
entire
cannot do that. Like IELTS, you cannot do it in OET. OET, the capitalization rules need to be followed where it's required. You cannot do that.
Can you
and
please, sir?
be listening
One by
part
one,
be,
guys. One by one, guys. Yes, tell me.
and is listening part be more harder than listening part A?
Yeah, the pace would be high. It's not harder. It's not difficult. The pace of the communication will be a bit fast. So you need to write it quick. Your handwriting, your speed need to be quick. That's all. Okay. But first
In
of all,
part
don't
B,
be
we will have a word limit.
for what word limit for? In listening?
In part B.
Listening,
In part B, yes.
listening, no word limit.
Yes.
There is no word limit in
Even
listening.
in part B.
Even in part B, there is no word limit.
And in part A, we can still add more bullets if we think that.
Yes, you can add more bullets. No, you cannot add more bullets. Like for example, if your question has got 5 bullets, 5 blank spaces, you should be filling only that 5 piece of information, not more than that. Because every question will have. Yeah, tell me.
Sometimes it's not very clear, the information. Like if there's one listening I did last time, and he was saying, okay, describe the symptoms of this disease. And he was in the answer, it was giving also the age of the patient.
See, I'll tell you that if they're telling you about the symptoms, and when you're listening to the communication, you heard 8 symptoms, and your question has got only 5 blank spaces. So you need to only write the 5 symptoms. It's not required you to mention all the 8. It's not required. So you need to see how many blank spaces do you have in your question, and accordingly you need to input your answers. So you need to follow your blank spaces, not more than that. It's not even required. Okay.
I thought the examiner just pick the correct answer. They don't care if you add more information or not.
No. They don't care. They will not mark you down. They will not mark you down. Even if you add more, if you have a space over there and you just write more, you will not be marked down. You will never be marked down. But what I suggest is whatever blank spaces have been given, if there are 5 blank spaces given, you try to fill in within that. Do not write extra.
Can you please tell the speaking summarize last part? How did you say can you
see, summarizing is
repeat
nothing. There is not a particular task or particular way of doing it. I've just suggested a one way. Like concluding is rather than going through each and every part of the test, of the speaking test, you can say, so for example, I take the patient's name, Mr. Smith. Mr. Smith, I believe you understood each and every suggestions I've given to you, and I have answered all your questions. However, I understand your concerns about the condition, but my suggestions will help you to reach an optimal recovery. This is just one of the kind I'm saying. You can put it in your own words. What I'm trying to say is have a smooth end. So you're just reassuring with the patient that I believe you understood everything. I believe that my suggestions will help you, and I'm sure you're going to follow all the suggestions what I've given to you. So you're just trying to have a smooth end. That's all. Okay.
Thank you. Yeah.
Anyone else? Any questions, guys? Okay. I believe no other questions. All the best, guys. Those who are writing your exams tomorrow, do well, be positive. Just hope for your exams. You will do wonders, I'm very sure. Okay, thank you so much.
Excuse me, sir.
Yeah, Shanata.
Yeah. Please, I have so many hanging writing tasks that is not yet assessed.
So please, I'll just forward it to the group. I'm not the assessment actually do it. That is
I'm telling you so that you can talk to them, because
definitely.
I've been
I'll
writing,
do that.
I've been doing everything, please.
I will do that today, and I'll make sure that has been done for you.
Okay, thank you.
Perfect. Thank you so much. Have a good day. Bye.
Yeah, thank you. Bye.
Thank you.